Now, Secretary Kennedy, I want to start with what I hope is an easy question for you. Do you think lead poisoning in children is a significant concern?
Is lead poisoning
In children, a significant concern?
It's a extremely significant concern.
Thank you.
At a heated budget hearing, Senator Tammy Baldwin, DWI, confronted Health and Human Services Secretary Kennedy over what she described as a reckless lack of transparency and devastating program cuts. From the denial of federal aid to Milwaukee schools grappling with lead poisoning to delays in Head Start funding that left families stranded, Baldwin accused the administration of hiding information and abandoning vulnerable children. The tense exchange laid bare a central question: is the government fulfilling its responsibility to protect the health and future of America's kids?
Secretary Kennedy, you run a department that touches the lives of almost every American. Yet, for this budget hearing, these are the 6 pages that we have gotten in terms of your budget request. We are also 7.5 months into this fiscal year, and yet you are not telling the American public anything about how you are spending the billions in taxpayer dollars right now. You had to submit an operating plan to the Congress, and this is just a sample page, but 530 programs simply have asterisks. Secretary Kennedy, this isn't about your hiding information from me. This is about your hiding information from the American public. And if you're going to cut cancer research or gut mental health support, at least stand by your work and explain it to the American people. Now, Secretary Kennedy, I want to start with what I hope is an easy question for you. Do you think lead poisoning in children is a significant concern?
Is lead poisoning
In children, a significant concern?
It's a extremely significant concern.
Thank you. Then I would like to know why your department has effectively shut down the very program to address lead poisoning in children. The city of Milwaukee requested assistance from the CDC to help the city respond to lead poisoning cases tied to public schools. 6 schools have been closed, displacing more than 1,800 school children. The request for federal assistance was denied because of lack of staff. The entire childhood lead poisoning branch has been fired. In the words of a Milwaukee mom, it really sends a message of, you don't matter. I don't know what you would say to parents who must now test their children for lead and deal with school closures. But do you intend to eliminate this branch at CDC, yes or no?
No, we do not.
Okay. Because you cannot tell us that you want to make America healthy again when you are willfully destroying programs that keep children safe and healthy from lead poisoning. Congress dedicated $51 million in funding for this particular program. But when a community asks for help to prevent lifelong complications for children, and there is no one there to pick up the phone, and it's not because this program is ineffective, it's because you fired the entire team whose job it is to support communities like Milwaukee.
If that money has been appropriated, we will spend that money. If it's been appropriated to Milwaukee, we will spend it in Milwaukee. I've spent a lot of time in Milwaukee
It's
working
to provide
on
expert, and the entire staff has been fired. Secretary Kennedy, I did note in your opening testimony, although we wouldn't know it from the skinny budget that we have, that you plan on funding the Head Start program. But I want to tell you about the ramifications of what has happened to date with regard to Head Start. I've heard from families across the state, people who are terrified about the uncertainty and instability surrounding Head Start. Just 1 week into President Trump's administration, Head Start programs in Wisconsin suddenly couldn't access their grant funding. It forced one Head Start in Waukesha, Wisconsin, to temporarily close, leaving 250 families without care. Over the last 4 months, HHS has provided roughly $1 billion less to Head Start programs across the country than during the same period last year. The delays in funding have exacerbated uncertainty for programs needing to make payroll. And in some instances, like the one I cited in Waukesha, programs have had to shut their doors until the payments came through. Now, I don't know what you would say to a parent who is unable to drop their child off at preschool because you failed to get already appropriated money out the door. Or maybe I should ask you, what would you say to a parent who shows up for child care or for Head Start and the doors are closed?
I would be very sad if somebody shut up. I fought very, very hard to make sure that there would be
What
no
is
cuts.
causing the delays in
As I
Head Start
said,
funding?
I fought
That's my
very,
question.
I fought very hard to make sure that Head Start gets all of its funding next year.
Well, we need it this year, and why are there delays now?
I don't know that there are, Senator, and I will look into it. But I don't know, there should not be any delays. The funding is there. We are spending it. It's allocated. I don't know why there would be those kind of problems. I can tell you that within the agency, there were, there were people who wanted to make the Trump administration look bad, and that there were checks held up that shouldn't have been. I will have to look into that, Senator.
Senator Tammy Baldwin began her questioning with a blunt assessment of the budget hearing. Just 6 pages of documentation had been provided by the department, despite 7.5 months already having passed in the fiscal year. For Baldwin, this wasn't merely a matter of disrespect to Congress. It was, as she emphasized, about denying the American public the transparency they deserve regarding how billions in taxpayer dollars are being spent. She produced a sample page from the department's operating plan, noting that out of 530 programs, many had been reduced to nothing more than asterisks. In her view, this was not oversight or efficiency, it was concealment. Baldwin declared that if the department was planning to cut cancer research, slash mental health support, or eliminate public health safeguards, then it owed the public a full explanation. The exchange then shifted to a deeply pressing concern, childhood lead poisoning. Baldwin asked Secretary Kennedy what seemed like a straightforward question. Do you think lead poisoning in children is a significant concern? Kennedy answered without hesitation that it was an extremely significant concern. That admission set the stage for Baldwin's sharp rebuke. She revealed that the CDC's childhood lead poisoning branch had been effectively dismantled, the entire staff fired, leaving communities like Milwaukee abandoned. The consequences were immediate and severe. 6 public schools closed due to lead contamination, displacing more than 1,800 children. When Milwaukee requested federal assistance to address the crisis, they were denied due to lack of staff. Quoting a frustrated Milwaukee mother, Baldwin underscored the emotional toll. It really sends the message that you don't matter. To Baldwin, this wasn't an abstract policy debate. It was about real children, real parents, and a public health crisis that, without intervention, could leave lifelong scars. She demanded a clear answer. Did the department intend to eliminate the CDC's lead poisoning branch? Kennedy responded that they did not. But Baldwin countered forcefully. How could the department claim to value children's health when it had already terminated the very team tasked with protecting them? Congress had appropriated $51 million specifically for this program, Baldwin noted, and yet communities like Milwaukee were being met with silence when they asked for help. Kennedy insisted the money would be spent, but Baldwin highlighted the contradiction. If the staff was gone, who would carry out the mission? From there, Baldwin turned to another program vital to families, Head Start. The early childhood education program has long been a lifeline for low-income families across Wisconsin and the nation. Yet Baldwin revealed alarming disruptions since the beginning of the Trump administration. Just 1 week after the inauguration, Head Start programs in Wisconsin suddenly lost access to grant funding. In Waukesha, one center was forced to temporarily close, leaving 200 families without care. Across the country, Baldwin reported, HHS had delivered $1 billion less to Head Start programs over the past 4 months compared to the same period the year before. These funding delays weren't abstract bookkeeping issues. They left providers unable to make payroll, staff uncertain about their futures, and parents scrambling when doors suddenly closed. Baldwin pressed Kennedy, "What would you say to a parent who shows up for childcare or Head Start and the doors are closed?" Kennedy offered only, "I would be very sad." For Baldwin, this was wholly inadequate. She demanded specifics about the cause of the delays. Kennedy responded vaguely, saying he had fought very hard to protect Head Start funding and that there should not be any delays. He then suggested that internal forces within the agency might have intentionally slowed the process to make the Trump administration look bad.
The exchange captured the stark divide. Baldwin insisted that families in her state couldn't afford excuses or political blame games. They needed stable, reliable support for their children's health, education, and future. Kennedy, meanwhile, appeared unable or unwilling to provide direct answers, leaving many of Baldwin's questions unresolved. In the end, Baldwin's line of questioning crystallized the stakes. A government that fails to fund public health programs, shuts down prevention branches, and delays critical education grants is a government that leaves children behind. For parents in Milwaukee, Waukesha, and beyond, the gaps in leadership weren't theoretical, they were painfully real. Senator Baldwin's exchange with Secretary Kennedy was more than a budget skirmish. It was a confrontation over priorities. With programs for childhood lead poisoning prevention gutted and Head Start funding delayed, Baldwin's message was clear: children's health and education are non-negotiable. Her pointed questions highlighted an administration struggling to reconcile rhetoric about protecting families with actions that, in her view, undermine them. For the parents left facing closed schools, shuttered childcare centers, and unanswered calls for help, the stakes could not be higher.